My name's Lara, I'm 29 and I have acute myeloid leukemia. Since March, I've been shielding because I'm extremely vulnerable to COVID-19.
It is very easy to view an individual when you know a policy back to front as a unit of assistance to be given. And I think if we start thinking in that way, or if service deliverers start thinking that way, special measures or not, then actually it starts to fall apart.
It's vital at any time to put patients' voices at the centre of health policy and practice, but at the moment it's even more so.
The pandemic in some ways has amplified that when people don't fall neatly into a pathway, they can fall through the cracks.
Health and care services are being delivered differently during the pandemic, but there are so many stories about health and care that remain untold by the media and unheard by the people who are making decisions about those services. And that's where we hope our COVID Voices, this platform for people to share their experiences of life under lockdown and beyond, can make a difference. A few years ago, National Voices did some work to explain in easy to understand terms what good, coordinated and person-centred health and care actually means. And they worked with people using services and with carers to develop what became known as I statements.
One of the most famous of these was the statement, "I'd like to tell my story only once." The idea of telling your story only once is, in a sense, a very simple common sense idea, but was very radical in terms of changing the nature of health and social care. And therefore, all of the statements that are made as I statements around COVID will at the one at the same time be very straightforward and very important for patients, but will bring about a great deal of potential change in the way in which we do things.
Good morning. Today is day 43 of my self-isolation.
We reviewed these original I statements in light of the COVID pandemic, and we found they still stand. But we also found that there is some stuff that is different about the situation we're in now, and that therefore the people we spoke to felt there was a need to put some new expectations on the record to describe what good care and good health need to look like during this period of also managing a deadly virus. The result of this work is a new set of I statements, our I statements 2020, which describe what we need now.
I think we're very used to hearing terms such as person-centred care, personalisation, working with people. The reality for many people is that that is not the case, that they still see themselves as not really being seen in the system or heard in the system.
People feel abandoned. They feel like they're in a relationship with a service provider, and that comes with expectations about how we need to be spoken with and how we need to be listened to. And if those expectations aren't met, it makes people feel like they're in a very dysfunctional relationship with the service provider.
I have got respiratory conditions, and which is asthma. I received a letter from NHS England telling me that I fall under the vulnerable category and therefore I need to shield. I contacted my GP to find out more about the shielding, and I was told by my GP that I fall under the high risk category and I do not have to shield. The COVID-19 itself, was disturbing, alarming, shocking, and to have two contradictory information about whether I need to shield or not to shield was quite worrying for me, and it created some anxiety.
I shouldn't imagine anybody that's elderly or disabled in whatever way likes the term vulnerable, but we can credit ourselves as much as we might want as blind and partially sighted individuals, disabled individuals, whatever. But a situation like this that breaks down structures without anyone intentionally meaning to, they do render people temporarily vulnerable. I suddenly found myself feeling more vulnerable than I'm used to being, and it took quite a while for me to sort of recalibrate how I viewed things and how I was going to cope.
There are over 2 million people who are extremely vulnerable to COVID. I want the government and the general public to be aware of our needs, which include ongoing support to stay safe in public and in isolation, in spaces of education and employment.
If you are designing services or if you are a health and care professional, what could you actually practically do to realise these ambitions?
While people may have mixed ideas about the future of health and care, about structure and funding and leadership, we can all agree and we can come together around the I statements as an explanation of and a vision for what we're trying to achieve, and one that has people, the end users, actually at its centre.
What we're hoping is that you will come on board with us and that you will work with us to realise these ambitions that people have put on the record. This is what we need now, and we need your help in making it happen.